faith. Have faith. Believe in your source. Have faith.
Welcome to Artists, Icons, and Entrepreneurs, the podcast that dives deep into the stories of trailblazers who shape our world. Our co-host, Lulu Benavidez, is a seasoned entrepreneur in the beauty industry, is a photographer, artist, and the proud owner of Lulu's The Salon in Galveston, Texas. Our other co-host, Krokonis Hanson, is a visionary in the entrepreneurial world with years of experience in business innovation and development. Together, they bring you insights, inspiration, and the journeys of remarkable individuals who have made their mark. And with that, let's get started. Dr. Katherine Ortiz is a board-certified and fellowship-trained in anti-aging, hormone, integrative, and functional medicine and has been in practice in the SWFL area for the past 17 years. She opened DNA Wellness and Longevity Institute in 2014 because she was passionate about genuinely helping people get to the root cause of disease and not just giving medication to cover up a symptom. She has experience in family practice, functional medicine, integrative medicine, women's health, men's health, and aesthetic medicine. She opened her practice called DNA, Define Natural Aging, Wellness, and Longevity, and practices functional, integrative, aesthetic, and hormone medicine. She focuses on treating patients with individualized care and treats the root cause of disease and not just the symptoms. Some of her expertise is in gut microbiome issues, adrenal problems, and hormone dysfunction. Her practice focuses on preventing disease, advanced metabolic testing, micronutrient testing, advanced microbiome testing such as food sensitivity and candida testing, biomarker testing, blood, urine, and saliva hormone testing. She is one of 3,500 trained healthcare providers in the United States with this board certification as a diplomat. Currently, she is the only doctor of integrative medicine in Southwest Florida. Dr. Katherine Ortiz has extensive training and knowledge in aesthetic medicine. She is educated in both technique and the science behind the administration of injectable facial fillers, such as Radius, Juvederm, Restylane, and uses Botox cosmetic and other neurotoxins, as well as for liquid face lift techniques. She is also trained in thread facelift and body lift procedures. She obtained her aesthetic training through PALETTE, Aesthetic Training, Allergen Incorporated, MERS, Galderma, Aesthetic Institute, and locally known plastic surgeons and oculoplastic surgeons in the state of Florida. She is a certified provider for PRP services for the trademark procedures: vampire facelift, vampire breast lift, the O-shot in women, the P-shot in men, hair restoration, joints and tendon with platelet-rich plasma and stem cells. Please welcome in Dr. Katherine Ortiz.
Welcome to Artists, Icons, and Entrepreneurs. And we're so excited you can join us today. We ask you, if you enjoy this, to please hit subscribe and follow us, as we have many interesting guests, professional business women, artists, all kinds of people in the professional health and wellness field. And we are so excited because today we have Katherine Ortiz with us. Katherine, thank you so much for being with us today.
Thank you for having me.
Yes. Well, we are so glad that you can be here. You have such a comprehensive resume as a doctor in functional and integrative medicine, specializing in longevity. And you're also a well-known business person here in the Southwest Florida area, which is where I happen to live, and how I come to find out about you. Our podcast is interested in all things that shine a light on women who pioneer business and, of course, in health, wellness, and beauty, because today, health and wellness are beauty. So we want our audience to get to know you and understand a little bit about what you do. And your clinic has been like a beacon of hope for so many women here in Southwest Florida. So would you just tell us a little bit about yourself? And you're so accomplished. Why did you decide to go into this particular field of functional and integrative medicine?
Yes. So why I did integrative anti-aging medicine was because in 2007, when I started practicing general internal medicine, I saw that there was a lack of congruency. So we need to dig deeper and look deeper into root causes of aging, cardiac disease, hormone replacement, longevity. When I first started practicing, it was basically just giving a medication to cover up a symptom, and I thought that was actually doing a disservice to patients. So I went back to school for training to be an IMD and a PhD in integrative medicine, as well as the fellowship in anti-aging, functional, and hormone medicine. So after that is when I opened my practice in 2015. So that's really how I got into this, because I just thought mainstream medicine wasn't really looking at the whole picture, and it wasn't giving a clear-cut answer to what was really going on in a person's body from the inside out.
Okay, welcome again, Dr. Katherine Ortiz. You know, this is my first time visiting you, and I know Sue highly talks of you. And can you tell us about our audience? Your clinic offers genetic and natural training. Does it work, and who does it work, should it be for?
Yeah, so we do offer both genetic and nutritional testing. It can work for anyone aged 18 to 95. So what we really look at is intracellular micronutrients, something as simple as a specific amino acid or a specific vitamin that's in excess or very deficient can create disease. So that's one of our specialty testing. We also look at genetic markers in the body, such as methylation pathways that occur in the liver. This is essential for patients struggling with diseases such as fibromyalgia, chronic fatigue syndrome, and hormone deficiencies. Because if they have this genetic marker, they're going to need specific micronutrients and specific hormones to correct the systems in the body.
Okay, so what does the patient has to do in order to receive this? So do they do blood work? Is that how you find out?
So we offer a different modality of testing. Some of the testing is through blood work, other is through dried urine testing, and still others is through saliva testing.
Okay, so there's three ways to test for these modalities or these infections or whatever happens to our body that stop us from anti-aging or nutrition, or we find out what diseases we're going to encounter. Is that correct?
That is correct.
Okay.
It makes so much sense to me because I feel like for years traditional medicine treats the symptom, where I think a more natural approach is really looking to a person's individual body and seeing what that does. And I think that you're at the forefront of this, and you just look at what's happened in the country. People don't know this, but Lulu is a gym rat. She's a girl. Yeah. And you know, there's a whole generation. Lulu and I are born in the same day,
Yeah.
the same year.
Right.
We're actually twins.
Except I have dark hair and she has light hair.
It makes so much sense to me that this route of medicine fits with women our age who are interested in, you know, staying young and staying active and working out and all of the types of things. I always kid and say 70 is the new 50. I mean, that's, you know, that's just the reality of our lives now. I think one of the things that I'm really interested in talking to our audience about, because Lulu and I both come from the beauty industry, which has a large population of women as stylists and as artists, and for the most part talking and working with women every day, as do, you know, manicurists and massage therapists and, you know, people in this industry. And yet I feel like there's just not enough knowledge out there about pre and post menopause. And you actually work with the bioidentical hormone replacement therapies. And I also think there's a lot of maybe misinformation. So can you just, you know, how you got into that and how it works and what you see through your practice, you know, these many years later?
Yes, absolutely. I do get a lot of questions on bioidentical hormone replacement because it is a different type of hormone than old school synthetic hormones. So bioidentical hormones, they're derived from plant sources and yams, and they look more like our own body's receptors. So our body accepts them more rather than trying to reject them. The mainstream medicine does still prescribe a lot of the synthetic hormones, and those are made with conjugated horse urine to make those hormones. So a lot of people have terrible side effects with synthetic hormones, whereas bioidentical side effects are extremely rare. And if they do have side effects, they last maybe 2 to 3 weeks, a tiny bit of bloating while the body adapts to it, and some people can have a little bit of breakthrough bleeding. But other than that, no negative side effects. Mm-hmm. Evidence shows there's less than 1% of cancer that's induced by bioidentical hormones versus synthetic hormones carry a lot higher percentage than that. And what's great about the bioidentical is it can be very customized. It's not a one-size-fits-all such as synthetic hormones. So we can customize and, complete precision for your progesterone levels, your adrenal function, your thyroid hormones. We could add different types of estrogen, not just the old school estradiol, but we can add estradiol and estriol, which is a combination of E3, fit your body, as well as customizing bioidentical thyroid hormones. So it has a very, wide array of benefits for women and men.
I think one of the pieces of misinformation that is out there is, I think when people talk about hormone replacement or therapy, they think it's just for sex drive, but in reality, it's for a whole variety of other functions that happen in the body. So what are other benefits that come from having this therapy?
Yes, so benefits for women are down regulating neurocognitive decline, so delaying onset of Alzheimer's, dementia. It's great for mental clarity. It's also great for cardiac health. We actually have more estrogen and testosterone receptors around the cardiac system than our sexual organs. It prevents osteoporosis, it prevents hair loss, it prevents losing collagen and elastin fibers in our skin, and it just gives us better quality of life. So many brain, heart benefits. Yes, we do have the sexual benefits, which is our secondary, but the primary ones are better system organ health.
So are there any side effects to this biohormone replacement therapy?
So side effects are rare. We have seen some in the practice. Most of them resolve within 2 to 3 weeks, and those can include a little bit of water retention at the beginning while your body adapts to the new levels of estrogen, progesterone, testosterone. And then some of our patients that are on the bioidentical pellet therapy, they can have a little bit of breakthrough bleeding, which usually resolves on its own.
So you're saying that this replacement is either in a pellet form or can it be injected?
There are different types of bioidentical hormone replacement modalities. So there are injections. Some people prefer that. That's my least favorite type for women. Okay. There are patches that are bioidentical. There are transdermal creams that you rub on to the inside of the lower arms. There are sublingual, which go underneath the tongue, and then the pellets, which go right into the hip glute area, which are steady state for about 3 to 4 months. So we do offer all of those modalities.
And each of them do the same thing, or each of them do something different?
So each of them can be comprised of the same ingredients.
Okay.
Usually what we would do is combine 2 types of estrogen with the testosterone.
Uh-huh.
And then when we're replacing other bioidentical hormones such as progesterone, that is preferred in a capsule at bedtime, since that really works on the GABA receptors in the brain and helps us sleep. And that also helps prevent neurocognitive decline.
Well, who wouldn't want that?
I know it. I know.
if I'm understanding the concept is that you have a blood test, and then based on the blood test, it's formulated for each individual person. And there's a variety of ways, everywhere from maybe wearing a bioidentical patch all the way up to pellet injections. Is that pretty much the, yeah?
Yes, that's correct. So we do a full panel of blood work. Sometimes we'll also do the urine test at the same time, the dry urine. We look at every hormone pathway in the body, from the pituitary, hypothalamus, thyroid, ovaries, and adrenal function. They all correlate together. And then we can customize each one to your exact levels and your exact symptoms.
Yeah.
So if I was a patient and I came to you, what are the actual steps do I have to take in order to receive this type of service?
Yeah, so what we would do is bring you in for a consultation, a 1-hour consultation to go over a complete health history, risks, benefits, really screen for any family history of cancer, breast cancer, or uterine cancer, because some of those patients need the additional genetic testing to see if they carry the markers. Some of those cancers can be induced by hormones, so we always want to rule that out.
Okay.
And then we would schedule labs for you, whether it be fasting blood work and or dry urine testing, get the results back, and then you would come back in and we would go over all the numbers, all the levels, and all the various types of bioidentical forms, and it's all preference for the patient. Some patients prefer to have the pellets because they don't really have to think about putting anything on every day or taking any pill or a sublingual tablet. So those are very convenient. I have some women that love the patch and have been on that and swear by it. So, if they're doing well on that, we don't want to change that. So everything is customized. But we do like to have a thorough consultation to assess all the risks and benefits.
Okay. All right. So what other services do you offer in your clinic?
Sure. So we offer a whole host of anti-aging anesthetic services. So we do offer the traditional neurotoxin, Botox, Dysport, Xeomin, and all the fillers, such as Restylane, Radiesse, Juvederm. We also offer a whole host of services with platelet-rich plasma, such as the Vampire Facelift, the Vampire Breast Lift, the O shot for women, the P shot for men, and the hair restoration with the PRP.
Okay, let's get at it.
Yeah, I know it.
Know about this O shot and this P shot. Because this is really to improve your sexual health and all of that. And it's for men and women. You don't just treat women at your clinic. So fill us in. Give us the scoop.
Okay, so the O shot is a very popular treatment for women, and women of all ages. What it helps with is enhancing sexual sensation. So for women, it gives us stronger, faster orgasms. It re-stimulates and regenerates our G-spot, so we have more natural lubrication and more sensitivity, and also really reduces any type of urine incontinence, whether it be stress incontinence from coughing or sneezing. A lot of women have that after childbirth, or urge incontinence, when you really have to go to the restroom, you don't want to leak, and that happens to a lot of women, and this also helps reverse that. And what's nice about it is you're using your own platelet-rich plasma, which is the clear portion of our blood, which has the growth factors, and they can regenerate tissue, neurons, vessels, so it's all natural, so you're not putting a foreign substance in the body. The results do last about 1 to 2 years on patients for that. Yeah.
Have had a lot of back issues and back surgery. And recently I was at a very interesting seminar where they're talking about regenerative medicine, where they're taking, whether it's blood or bone marrow, and spinning it and using it to help in the problem areas.
Yes.
This sounds a little bit like some of what I heard in that seminar.
Absolutely, yes. So your own platelet-rich plasma, that's derived from drawing your blood, putting it in a specialized centrifuge, which we have the Regen, which is the highest grade centrifuge with the largest extraction of platelets. Also, if people are having more issues, pain, tendon, ligament, back, we would also consider adding external stem cells, such as amniotic stem cells, because those have over 250 growth factors, which can just add to the benefits and have additive effects.
Wow. Wow. It's just unbelievable. Between AI and regenerative medicine, it's
I know.
strange what's happening in the world today. Can you give our audience just an idea of the process of somebody would come to you with these issues, and also the cost? Because I know that was the one thing when they talked about, like, for example, with my back, it's not covered by most insurance companies, but they were hopeful that within the next 2 to 3 years, because this is now at the forefront of what's happening in medicine, that it could be.
Yes, I know all of us providers that are functional, anti-aging, integrative, we all wish this could be covered by health insurance because it helps so many people and it's so preventative. So the O-shot right now is not covered by insurance. The cost is $1,500, and depending on severity of symptoms, results can last 1 to 2 years. Sometimes patients will need another one in 1 year versus 2 years if they're having a lot more issues with the incontinence.
It's like giving up a Starbucks a day to find
You're right.
the fountain of youth.
Yes, absolutely, absolutely.
So that's one of the things that you tell a patient when they come in, that it's not covered by insurance because it's not a medical, what do you call it, medical
Insurance?
insurance, it's not covered by that. But the benefit out of pocket is $1,500, and $1,500 is nothing compared to what you get in return,
Absolutely, absolutely. For example, I have patients that come in for urinary incontinence and, their OBGYN has recommended surgery. So, of course, we do a full exam on the patient, look inside there, if there truly is something such as a cystocele, which is the outpouching of the bladder, yes, surgery is needed. But if it's just related to, the muscles, the tendons and loss of growth factors, that can be resolved with the O-shots. So then they get that done, they have the benefits, and no surgery is needed.
Well, that's so good to know, because we have a mutual friend, Sue and I, that's always after us to get the pellets done, because she gets all this other stuff done.
Yeah.
And one thing that she's always after me, she says, I'm always going to the bathroom. I'm always peeing. So that sparked interest in me. I need to fly down to Florida and see this person.
I have a place for you to stay.
Oh, well, good. Then it won't cost me a hotel.
From even a more practical standpoint, and I think maybe because we enjoy it, but there are a lot of women, business women today, who are still working well past 50, 60, and you're busy and on the go. So you want your body to keep up with your mind and your pace that you're used to going at. It's not just about the vanity of staying young, it's about staying functional. And so many of these things, that's why I'm so glad you're on our show, because I think women just need to know the options and the truth. And I know your clinic is doing so well that you're actually expanding to a larger, newer facility, because just like it's taken time for holistic medicine to come into its own, I think all of these things are really beneficial,
Yes, they definitely are.
We're talking all about men, or women, but we have a lot of male listeners, and we just kind of skipped over this P-shot treatment. Do you want to talk about that a little bit?
Absolutely, yes. So the P-shot is very effective for men. It's indicated for erectile dysfunction. It's also indicated to increase sensitivity, and the other indication is for Peyronie's, where men have that curve in their penis, which can happen from genetic factors, or it can happen from trauma. So the P-shot does, into those 3 areas. So it gives stronger, larger erections. It does increase size. We always tell patients about a half an inch each way, length and girth. So some men, they will take Viagra, they'll take Cialis. With the P-shot, they don't have to take those medications every day. Or if they do need them once in a while, they will work much better. And then for the Peyronie's, the curve, that usually requires 2 to 3 treatments for resolution. And that really helps because some of those men are in pain, from that curve. So that does help. And I always tell my male patients, yes, P-shot has tremendous benefits, but I also want to look at all their biological markers, including testosterone. Because if they're extremely deficient, which deficient means different numbers for everyone. The range of testosterone for men goes from 250 to 1200. Most men are optimized between 800 and 900. And there's a lot of men, young men in their 20s and 30s with levels lower than 250 because of what is in our foods, all the chemicals, all the xenoestrogens, all the plastic. So having their levels tested and optimized will increase the effects of the P-shots.
Right. Yeah.
So you're saying they actually get blood work or they get a shot?
So yes, if we're doing a consultation, we'll check the blood work for all their hormone levels. But the P-shot procedure, that's actually done where my nurse will draw the blood. We will spin the blood, extract all that platelet-rich plasma, and the penis gets injected in 5 points. Everything is numb, so no pain. So 5 points, the corpus cavernosum muscles, the corpus spongiosum muscle, and not directly into the tip, but into the ring, which infiltrates that whole glands, which increases their sensitivity by tenfold.
Wow. That's interesting. That is so interesting.
Yes, and I have so many male patients that have done it, and trust me, all of them are nervous because men think a needle there is going to hurt. Everything is numb. We ice, and discomfort may be a 1 on a scale from 1 to 10.
Wow.
Yeah.
Do you find that men are more resistant to having that or to seeing you, matter of fact?
I mean, some men do, they don't always want to tell a female doctor all their symptoms. But once you really, open up with them, get comfortable with them, they will tell you. Mm-hmm. And most of them have actually been more open to the P-shots than in years past, because they have seen the effects from friends of friends or word of mouth of how great the results are.
Wow. That's interesting.
Very interesting. Well, and again, to me, this really ties in with the other part of your practice, which is really focusing on longevity, quality of life. What other holistic or health things do you offer at the clinic other than, the ones that we've been discussing so far?
Absolutely. So when looking at longevity, we always want to look at specific biomarkers. We want to look at the telomeres, which are the end caps of the cells. Those correlate with aging, and those get shorter as we get older. So we want to minimize that. Also looking at other biological factors such as insulin. Insulin is the #1 biomarker for endothelial damage, which is damage to the lining of the blood vessel, which correlates with heart disease and neurocognitive diseases such as dementia and Alzheimer's. So looking at those biomarkers in detail, we have formulated a lot of treatment modalities with IVs and peptides. So a lot of our patients who have cardiac buildup and glycation markers, which are from sugar in the blood, that's actually what creates the unstable plaque. We do treatments with NAD, which is a specific peptide, and glutathione, which helps pull plaque off the arteries and reduce inflammation. So that's at the forefront, are our specific IV therapies for neurocognitive and heart disease. And it really enhances the length of our telomeres, which are our aging biomarkers. And those are measured before and then after treatment.
Because it's not just about living longer, it's about the quality of life that you have
That's
when you're
right.
living longer.
Absolutely. Well, everyone have great quality. You know, our time is limited here. No one knows, you know, when our day is up, but we want great quality while we're here.
Isn't that the truth? Isn't that the truth? You know, I'm a big fanatic, like Sue said, you know, I exercise 3 times a week. Well, I haven't exercised the last couple of weeks. But normally I have a personal trainer and I exercise 3 days a week. So to me, longevity is important, you know, how I move, because, you know, there are things that happens in life to us
Yes.
that you try to make sure that quality of life is there. Whether it's hormone replacement, whether it's exercise, whether it's eating right. Do you, in your practice, in your consultation, do you go over the nutrition part of it?
Yes, the nutrition part is key. I always tell my patients that come see me, I said, nutrition and gut health is so key. Old school, they used to say our gut is our second brain. It's actually our first brain. So looking at markers such as food sensitivities, zonulin levels, candida levels, you know, good and bad gut bacteria, that all correlates to our overall health and overall inflammation of the body. Nutrition is so key. We could be eating something healthy such as spinach or broccoli, but if our body's reacting to it, it's causing inflammation. Therefore, it can cause disease in our body and osteoporosis. So that is important. Also, when you were talking about exercise, building muscle is one large key to longevity. That is a huge way to prevent aging and slow it down. Yeah. Muscle is key. It really is.
It
And
is.
it's good for our brain health too.
Oh my God. So you are such an interesting person. And of course, we would love to have you back, because there's so much more that we can ask you that we don't have enough time. Just the little that I've known in this past 40 minutes with you is amazing. You know, just understanding a little bit more about what is bioidentical hormone replacement, and, you know, all the stuff for men that you do in your practice is unreal. So thank you so much.
Thank you. Thank you for having me. And I enjoy helping people and getting that information out there.
Oh yeah, definitely, definitely.
And for the women in Southwest Florida who are saying, I don't have any energy, I ache all the time, I'm really over the sex thing, I'm going to give up golf because I just can't, you know, these are all people who could book a consultation, right? And you could maybe find the root cause of why they're feeling that way, rather than just going, oh, I'm a year older. I mean, there's real things, scientific things that can be done. How would people find out about DNA Wellness? Where can they find you? How do they book a consultation?
Yes, absolutely. So, of course, they could book consultations on the website, which is defynaturalaging.com. They could also call our office, which is located in Bonita Springs. Our phone number is 239-250-7930. They can also find us on Facebook at DNA Wellness and Longevity Institute, and on Instagram at Defy Natural Aging.
So what Lulu and I really want to know is, if we both come in, do we get a buddy system break? I can think of several things you talked about that we would be interested in.
Of course, there's always the buddy system discount.
Really teasing.
Be happy.
Yeah.
Happy to. there's so much more we can talk about too. There's so many other services.
Oh, I know.
We'd love to have you both come in.
We have you come back on the show because I know you can't possibly scratch the surface in 40 minutes, but I think it's a topic that our audience is interested in. Please, if you're out there listening, click follow, click subscribe, because that lets us know the topics that you're interested in hearing more about. And I'm just delighted in your busy schedule that you would make time to come on Artists, Icons, and Entrepreneurs and share this wonderful piece of medicine that you've been pioneering in Southwest Florida.
Oh, well, thank you. I really enjoy it, and I'll always take the time, to get the word out there and to help people, because I feel like a lot of people genuinely need this type of medicine and they just don't know about it.
Dr. Ortiz, and we would love to have you again back and talk more about it. And I'm gonna read this over. I'm gonna read your resume, and there's so much that you have to offer people, especially those in our industry that want that wellness, whether it's nutrition, whether it's getting that bioidentical hormone replacement therapy, whatever it is, you do it all. So thank you so much.
Thank you so much for having me. It was great to speak with you both.
Okay.
Thank you. Like we like to say, be well.
Yes.
Well. Thank you so much.
Yeah, you're welcome.
Thank you.
Wow, what an episode. That wraps up another exciting edition of Artists, Icons, and Entrepreneurs. Thank you so much for joining us. We hope you're leaving inspired and ready to chase your dreams. Don't forget to follow us on social media and subscribe to our podcast so you never miss an episode over at youtube.com/Artists, Icons, Entrepreneurs, as well as Facebook at Lulu Benavidez, on IG at Lulu Benavidez, at Evolve Hair Solutions as well. And don't forget to visit our website at lulubenavidez.com and evolvehairsolutions.com to stay updated. Until next time, keep dreaming big, creating boldly, and making your mark on the world. Thanks for listening, and take care, everyone.